So the project is KidzMedz Cymru, and yeah, the aim is to improve medicines adherence for children. So a little bit about the background and the principles of it. So our aim really is to teach our paediatric patients how to swallow tablets and capsules in a safe manner. Historically, for patients who don't need a lot of input from healthcare, it can actually be, a case of parents trying to get them to swallow a paracetamol tablet for the first time and sort of being, told you need to swallow it, and it dissolving on the tongue, and it can be really horrible. So yeah, we're trying to provide this education in a much safer and more comforting environment for patients. So we also want to switch those patients who are on liquid and granular medicines to tablets and capsules, or to actually just be prescribed tablets or capsules from the start of their treatment. And actually, one success story we've had is patients who have prescribed methotrexate injections for rheumatoid arthritis have actually been switched to tablets, which has been really great for some of our needle phobic children. So a little bit about the background of the project. We were really lucky to attend a initiative called the Spread and Scale Academy in September 2022, just to try and get our project underway. We attended the Cardiff and Vale Youth Council, so that was to get sign off from the children and young adults who are part of the Youth Council, and we had lots of great information and ideas from them to help with our project. We were fortunate enough as well to get staff lottery funding of £9,500 from the health board. So this really helped with us getting some resources and videos made as well. Then in June of 2023, we launched the project in our respiratory and cystic fibrosis team and the nephrology team as well. And that was because we have specialist pharmacists in those areas. So with it being a pharmacy initiative, it was a lot easier to get the project underway in these outpatient areas. And just recently in this summer, we were winner of the Prosperous Wales Award at the Welsh Sustainability Awards as well. So that was really great. And I'll talk in a minute now about how the project can impact with our sustainability as well. So the reason behind the project and trying to provide this education package to teach children how to take tablets is that actually taking tablets and capsules is a life skill. Many of us, will be taking tablets and capsules at some point in our life. So it's better to start learning earlier, so it's sort of less traumatic. And actually, we find that a lot of our younger patients, children who are 4, 5, 6 years old, actually adapt a lot quicker than some of our teenage patients, so it can be a lot more difficult to train. And there's a lot of sustainability benefits behind taking tablets and capsules. With liquid medicines, they have a higher carbon footprint. That's due to the packaging, due to some of them having a very short expiry, and actually the distances as well. And we use a lot of unlicensed medicines. They may have to be made up in a specials unit. And again, that produces a higher carbon footprint. Trying to improve patient experience. That's both for the patient and their parents as well. Within Cardiff and the Vale being such a large health board and providing a lot of tertiary services, we have children who come from as far as Aberystwyth over, to see us. So some parents actually have to travel to Cardiff to get the medication because it can't be obtained in community pharmacies, but whereas perhaps a tablet or capsule could be readily available in their local community pharmacy. So it's improving the parents' experience by having the child learning to take tablets and capsules. But actually for the child, a lot of liquid medicines can taste horrible. There's cherry flavour, which is disgusting. We've got caramel flavour, so not very nice tasting at all. And actually some of the liquid medicines, they have excipients in them. So items in them that help with stability and making the product a whole. And some of these aren't built for children, these are built for adults. So we have a lot of safety implications as well there. Liquid medicines are a lot more expensive as well, and we have much more medication errors as well. So, with these being pediatric patients, we want to minimize the risk of any errors as much as possible. So with tablets and capsules, there are less of a error, especially with dosing and labeling as well, because we can have lots of different strengths of liquid medicines. So with the actual project, a child will be identified as being suitable. So they will be over 4 years old, have a safe swallow, and will be deemed appropriate to receive training. They will receive a kit which has dummy medicines in it. So you can see here on the slide. So we've got sugar sprinkles, millions, Tic Tacs, Skittles, small capsules and large capsules as well. We also have a sports cap drinks bottle and certificate and stickers as well for them. So with the training itself, it's a 6-step process, as you can see here on the screen. So try and do it in a nice, quiet area. We always let the child choose the drink as well. And we put that into the sports cap bottle, or if that's not available, we use a straw as well. So we start with the smallest practice sweets. So we use the sugar strands. To be honest, they actually dissolve on the tongue. They don't really get swallowed, but it's a great practice sweet to try. So you place it on the middle of the tongue, seal the lips around the bottle or the straw, and take 3 gulps without stopping. So it's gulp, swallow, gulp, swallow, gulp, swallow. And normally by the second gulp, the dummy sweet has already gone. And the child can move on to the next sweet. See if they get stuck and can't swallow it, we normally just go back a step and always try and end the consultation on like a really positive note. I've just got a quick patient example as well. So we have a 8-year-old boy who attends our hemodialysis centre 3 times a week. So he has stage 5 chronic kidney disease. He's fluid restricted, so he can only have 600 millilitres per day. And unfortunately, 100 millilitres of this is actually used up by his medication, which is a considerable amount, especially as this can affect his nutritional intake as well. So in November 2023, he received KidzMedz training and actually reached all the way up to the large capsule. So we switched all of the medication to tablet form that he was prescribed because he was really keen on trying to take the tablets and capsules as soon as possible. So medications of note that was switched was amlodipine. He absolutely hated the taste of it and actually had to have gulps of water after taking the liquid medicine. So again, that was another usage of his fluid restriction. Also calcitriol was changed. So that's an unlicensed liquid only available in hospital. So the parents had to come in every month to obtain medication. And actually the calcitriol tablets, they can be dispensed in local pharmacies. This was a lot better for his parents. And calcium carbonate as well. So he needed to have 80 millilitres per day of calcium carbonate. So that's such a large volume. I mean, it was spread over 4 times a day, but it's still such a large volume. And actually that meant that the parents needed 22 bottles per month of it. So their kitchen cupboards were full. So overall, through having the training, he has a lot better compliance with his fluid restriction. There is a lot more milliliters left for better nutrition as well, so better overall health, and actually has less medicines with sugar in it, so that's actually better for his dental health as well. And in his own words, he said taking tablet tastes like nothing. So it's really good outcome for him.